Welcome to COVID-19, Transitioning Back to Work, presented by Compliance Training Partners. Course objectives include understanding the epidemiology of COVID-19 and reviewing the latest COVID-19 guidelines. Also understanding the federal phasing system for reopening the country, developing a plan for transitioning back to work once the emergency interim period is ended, knowing signs and symptoms of the disease and how to screen patients, learning how to prevent transmission by utilizing work practice and engineering controls, understanding how to pick appropriate PPE, knowing what's considered a dental emergency or an urgency, reviewing infection control precautions for the dental team, learning best practices for infection control in a dental facility, knowing ways to go beyond standard precautions, and also learning techniques to reassure your staff and patients. The information contained in this presentation is based on OSHA, Centers for Disease Control, World Health Organization, and ADA guidelines. Compliance Training Partners, as well as its agents, dealers, and distributors, can't be held responsible for any legal actions, citations, penalties, or fines that may result from failure to comply. It's ultimately the responsibility of the business owner to stay current with all regulations and guidelines as they pertain to the operation of their business. Different parts of the country are seeing different levels of COVID-19 activity, but in all states, there's currently community spread of this disease. Now, while COVID-19 diagnoses and deaths are increasing in number, still, the rate of this increase is decreasing. At this time, efforts are focused on lessening the spread and the impact of this virus. And the federal government's working closely with state, local, tribal, territorial partners, as well as public health departments in individual states to respond to this public health threat. It's unknown how long it's going to take before everything gets back to normal, and also it may be a new normal. The goal of social distancing and all the special precautions we've been taking over the last month or so have been to flatten the curve. And that means getting the number of new cases to go below the capacity of the healthcare system to take care of them. And the curve in the United States is indeed beginning to flatten. In a document released by the White House, a plan was proposed for reopening the economy in the United States. This would include healthcare businesses such as dentistry. The plan utilizes gating criteria which must be achieved by states and regions before proceeding to a phased reopening. It allows states and regions to determine when and how to reopen. This document may be found at the Compliance Training Partners website. To satisfy gating requirements, there needs to be a downward trajectory of influenza-like illnesses reported within a 2-week period, and a downward trajectory of cases with COVID-19 type symptoms for a 2-week period as well. There also needs to be a downward trajectory of documented cases within a 14-day period, or a downward trajectory of positive tests as a percent of total tests within a 14-day period. Also, hospitals must be treating all patients without crisis care, and they must have in place a robust testing plan for at-risk healthcare workers. State and local officials have been given authority to tailor requirements based on local circumstances, for example, if it's a rural area or an urban area. According to the federal government, after gating requirements have been met, states and regions can allow elective surgeries on an outpatient basis to resume, assuming proper infection control measures are applied, and this would include dental procedures. But still, there needs to be enforced strict social distancing policies among employees. Telework is encouraged. I know that can't always be done in dentistry, but some of our front desk activities can. And also, a minimization of non-essential travel. To enter Phase 2, gating requirements once again have to have been met, and there has to be no evidence of rebound. And now outpatient as well as inpatient elective surgeries can be performed. Now there should be moderate social distancing policies among employees. Telework is still encouraged, but non-essential travel can resume. Phase 3 begins after gating requirements once again have been met and there's no evidence of rebound. Now there can be unrestricted staffing, no need for telework if you don't need to. but there still should be a minimization of time spent in crowded environments. Federal guidance states that in all three phases, we must develop and implement appropriate policies in accordance with federal, state, and local regulations and guidance informed by best industry practices regarding social distancing, testing, isolating, contact tracing, also sanitation, and the use and disinfection of common and high traffic areas. The reason we've spent some time describing gating and the three different phases is so that you can understand just how our local governments are looking at things, how they're making their decisions when we can go on to the next step. This presentation is going to outline current best practices that exist during this phase-in period, and they'll ultimately transition our profession to normal or to a new normal at some future date. First, a little background on COVID-19. COVID-19 is a disease caused by the SARS-CoV-2 virus. This is a new virus that emerged in China in December of 2019. It primarily spreads from person to person via respiratory droplets that are produced when the infected person coughs or sneezes, which is why social distancing is important. It's transmitted via inhalation of these droplets. It also may be spread by touching contaminated surfaces like doorknobs or armrests or tabletops. And then we touch our mucous membranes like the nose, the mouth, or the eyes. Since it's a new disease, there are many things we still don't understand, like the details of how it spreads and the severity of the illness it causes. Remember that it can live on surfaces for up to several days. The World Health Organization declared COVID-19 a pandemic in March of this year, and the CDC, the World Health Organization, and OSHA are continually updating guidance to help control the spread of this disease. Remember that technically COVID-19 is not considered a bloodborne disease, and it's not considered a bloodborne pathogen because it's spread primarily through respiratory secretions. But the OSHA bloodborne pathogen standard offers a great frame of reference for minimizing exposure and should be followed carefully at all times. Signs and symptoms of COVID-19 normally appear between 2 to 14 days after exposure. Some of them include shortness of breath, loss of taste or smell, a persistent pain or pressure in the chest, fever, headache, cough, chills or shaking with chills, muscle pain. If you develop signs or symptoms such as these, or anybody that you know does, you should seek medical attention promptly. But remember to call your personal healthcare provider for advice before visiting an emergency facility. Those at highest risk include individuals over the age of 60 and also people with pre-existing medical conditions like diabetes, high blood pressure, heart disease, lung disease, a compromised immune system, or cancer. Currently, emergency rules and guidelines have been enacted and they'll remain in force until the COVID-19 pandemic is passed. There are currently no reports of COVID-19 clusters in dental healthcare workers or in dental settings. And also, there is currently no data available to assess the risk of transmission in dentistry. The ADA has stated that only emergency and urgent dental treatment should be provided during the interim emergency period, but state-by-state guidance will be provided as to when and how you can transition back to being able to perform elective procedures. To prevent transmission, update patient medical histories before each visit by sending it to their home or their email address. Utilize teledentistry, in other words, using the phone or video for non-emergency consultations. Screen patients when confirming appointments and before arrival by asking them, have you been around somebody with a confirmed or suspected case of COVID-19? Have you exhibited any possible symptoms of COVID-19 like fever, cough, muscle pain, shortness of breath, headache, loss of taste or smell, chills, shaking, or chest pain? See the COVID-19 Pandemic Period Questionnaire found at the Compliance Training Partners website. You must tell all patients that answered yes to any of the screening questions to contact their primary physician or the public health department and that they need to reschedule their appointment. Treatment must be provided for them in a facility with airborne precautions, which would include a negative air pressure isolation room. You should work together with medical providers to identify such a facility if in fact they need immediate treatment. Call the public health department if you suspect a patient may have COVID-19. It must be reported. What if someone somehow gets through your screening process and someone ends up in your facility that's suspected or confirmed to have COVID-19? If this happens, take the following actions immediately. Place a face mask on the patient. Send the patient home if they're not acutely sick. If they're acutely sick, refer them to a medical facility, like for example, they have chest pain or difficulty breathing. If dental treatment is urgently needed, refer them to the appropriate facility. There are certain patients with COVID-19 who can be safely treated in your facility. The CDC states that patients with COVID-19 who have completed home isolation clearance can receive emergency dental care if they meet the following criteria. If it's non-test based, it would mean that a minimum of 72 hours have passed since recovery, and this would be defined as resolution of fever without the use of fever-reducing medications and improvement of respiratory symptoms, and at least 7 days have passed since symptoms first occurred. Or if it's test-based, if a patient's had a laboratory-confirmed case of COVID-19 but has not had symptoms and at least 7 days have passed since the date of the first positive COVID-19 diagnostic test. Also, they must have had no subsequent illnesses, but still it's advisable to confirm the patient's health status with their medical provider to make sure they're not infectious before you initiate any dental treatment. Methods to prevent disease transmission in your facility would include having a gloved assistant greet the patient at the front door after they text or call from their car. Record the patient's temperature in their car as soon as they enter your facility. Any reading greater than 100 degrees Fahrenheit must be sent for medical evaluation before you can treat them. Ask the patient to not touch anything in the office. Have the patient use an alcohol-based hand rub. Have them wear a face mask or cloth face covering, gloves, and disposable gown. Other ways to prevent transmission include having only one patient in the waiting room at a time, or even better, have them walk directly into the treatment room. Remember to have those accompanying the patient wait in their car, because if somebody accompanies the patient, they need to be screened for COVID-19 and provided PPE as well. Remove all non-essential items from your waiting room, things like magazines and toys and prize boxes and remote controls. Eliminate your in-person checkout that normally occurs at the end of the visit. This can be done online or via phone call after the appointment. Contact all your patients who receive care in your office after 48 hours and ask if they've developed any signs or symptoms of COVID-19. If they have, refer them to their medical provider and have your staff follow the CDC's healthcare personnel with potential exposure guidance that can be found at the Compliance Training Partners website. Throughout the day, disinfect high-touch surfaces in the waiting room like armrests and doorknobs and countertops with an appropriate disinfectant. Have the treatment room set up previous to the patient entering so that drawers and cabinets don't need to be opened during their treatment time. Remove all loose or non-covered items that aren't in drawers or cabinets from the operatory. Cover your computer keyboards with clear protective barriers and remember to change them between patients. Follow all the instructions for the EPA-registered hospital disinfectant you're using, but make sure that it's on the approved list for use against SARS-CoV-2. Until we reach the point that elective dental procedures are allowed by your state, we need to understand which procedures are considered emergencies and urgencies. Dental emergencies are potentially life-threatening. It would include bleeding, cellulitis, or any diffuse soft tissue infection with intraoral or extraoral swelling, something that could potentially compromise the patient's airway. Also, trauma involving facial bones that could potentially compromise the patient's airway. Urgent dental care is focused on managing conditions to relieve severe pain or risk of infection. and they should be treated as much as the condition will allow in a minimally invasive manner. We're talking about pain from pulpal inflammation, pericornitis or third molar pain, dry socket, an abscess resulting in pain and swelling, tooth fracture causing pain, an avulsion or luxation, and final crown cementation if a temporary is lost. Other things considered urgencies would be gross caries that was causing pain, abnormal tissue that needs to be biopsied, a suture removal, denture adjustments on radiation oncology patients, replacing temporary fillings on endo-access openings, dental treatment required prior to a critical medical procedure, also orthodontic wires or appliances that are causing pain. Standard precautions assume that every person is potentially infected with a pathogen that could be transmitted in a healthcare setting. Standard precautions would include minimum infection prevention practices that apply to all patient care. Included would be hand hygiene, personal protective equipment, respiratory hygiene and cough etiquette, as well as cleaning, disinfection, and sterilization. Hand hygiene remains one of the most important means of preventing disease transmission, including COVID-19. Selection of hand hygiene products should be determined by the efficacy of the antiseptic agent and the acceptance of the product by staff. Hand hygiene recommendations include not having artificial nails, keeping fingernails short with smooth edges to aid in proper cleaning and disinfection, and not wearing sharp rings or other hand jewelry that would compromise the fit or the integrity of the glove. Even though alcohol hand rubs are highly recommended, remember you need to wash with soap and water if the hands are visibly soiled, after direct contact with potentially infectious materials, before and after eating, after toileting, and before any surgical procedures, but then you need to use an approved surgical scrub. It's important that everybody on the team understand how to properly put on and take off personal protective equipment. Also, it's important to know how to dispose of, disinfect, and maintain your personal protective equipment because improper technique can cause the transmission of disease. All staff members should receive training. Refer to PPE donning and doffing, as well as 2 videos from the CDC on proper technique for donning and doffing at the ComplianceTrainingPartners.com website. Leave all protective clothing in the office for laundering or pickup by a laundry service. Masks, gloves, safety eyewear, and long-sleeve fluid-resistant clothing are required. During the COVID-19 pandemic period, protective clothing should be changed between patients. And remember not to wear protective clothing into eating areas. Place all protective clothing to be laundered in a fluid-resistant laundry bag like the one in this picture, labeled with the biohazard symbol. Gowns are required for all aerosol-generating procedures, and the use of disposable gowns is encouraged. Surgical masks are regulated by the FDA as single-use items. A face mask or a cloth face covering must be worn at all times by dental workers when in the office. Business office staff must also wear a cloth face covering or face mask while performing their duties. Dentists, dental assistants, and hygienists may wear cloth face coverings when not involved in direct patient care but must switch to a surgical face mask or a respirator when providing patient care. To preserve surgical masks during the COVID-19 pandemic, cloth face coverings may be utilized, but they must be changed if they become soiled, damp, or hard to breathe through, and they need to be laundered daily. All dental office personnel must perform hand hygiene before and after they touch their cloth face covering. Remember that they can be worn only when not providing direct patient care. If you take a look at the mask you use, you look on the box and you'll see different levels of 1, 2, or 3. And just what do these mean? An organization called ASTM International establishes performance levels for masks depending on a number of criteria, including bacterial filtration efficiency and fluid resistance. In order to be called a medical surgical mask, a minimum of 95% filtration of a bacterial-containing aerosol of 3 micron size droplets must be achieved. A level 1 mask filters out 95% of bacteria-containing aerosols. and it has low fluid resistance. A level 2 filters out 98% of these bacteria-containing aerosols and has moderate fluid resistance. Level 3 also filters out 98% of bacteria-containing aerosols, but it has a high fluid resistance. During this COVID-19 pandemic period, Compliance Training Partners suggests using a level 2 or 3 mask if the patient isn't suspected of having a COVID-19 infection and you're not performing an aerosol generating procedure such as one using a high or low speed handpiece, an ultrasonic scaler, or an air-water syringe. At Compliance Training Partners, our technical team is asked all the time, do offices need N95 or KN95 masks, and what's the difference? Well, first of all, they're considered equivalent at this time. An N95 or KN95 masks are really considered respirators by OSHA and have strict requirements, which include having a written respiratory protection plan, fit testing, and a medical evaluation of those people who will wear them. They should be used during the COVID-19 pandemic period if you're doing an aerosol generating procedure on a patient not suspected of having COVID-19. This means if you operate a high speed, a low speed, an ultrasonic scaler, or use an air-water syringe, you need to be using an N95 or KN95 mask, as these procedures have the potential to generate aerosols. Remember, we should never be treating known or suspected COVID-19 patients in our office because they should be treated in a special facility with negative air pressure isolation rooms. Refer to Respirators versus Surgical Mask and Respiratory Protection Plan at compliancetrainingpartners.com. If you're entering a patient room or a patient care area for a patient that's been screened and does not appear to have COVID-19, a surgical mask with a face shield may be worn. But if you'll be performing an aerosol generating procedure, an N95 or equivalent must replace the surgical mask. Face shields provide excellent eye and face protection, and they help protect the N95 from moisture contamination. Remember that face shields must be disinfected or replaced between patients. Remember that it's not just dental workers that need to protect their eyes. Patient eye protection is the standard of care. Make sure all patients wear protective eyewear during treatment. Gloves are an important part of personal protective equipment, and sterile surgical gloves need to be used for all surgical procedures. Non-sterile procedure gloves can be used for all other services. Disposable gloves can't be washed or decontaminated for reuse, and gloves must be replaced when they're torn, and they must be replaced between patients. Other work practice controls include utilizing a rubber dam wherever possible, minimizing performing aerosol generating procedures, eliminating the use of the ultrasonic scaler during the pandemic period and only doing hand scaling. Avoid touching of your face, including eyes, nose, and mouth, after removing personal protective equipment and performing hand hygiene, and allowing only the minimum number of workers in the patient care area. Remember that after the COVID-19 pandemic period is over, we're going to go back to normal or close to normal. But right now, we need to consider going beyond standard precautions. So staff members should glove in their car before they enter the office. When they enter, perform hand hygiene. Staff members should also wash their hands and then glove before leaving the workplace. And once they get in their car, they should remove the gloves and place them in a bag. Staff members should also disinfect areas they touch in their car on a daily basis. Staff members should self-monitor for respiratory symptoms like cough, shortness of breath, sore throat, and check their temperature at the beginning of each work shift. They should also remove their clothes immediately upon entering their home and take a shower. Have them launder their clothing separately from other members of the household. It's always been important to practice respiratory hygiene and cough etiquette, but now more than ever. So implement procedures to contain respiratory excretions in patients who are coughing or sneezing. This would include posting signs like this one at the entrance with instructions, providing tissues and no-touch receptacles, providing alcohol hand rubs and paper towels in your waiting room, and placing masks immediately on symptomatic patients. Environmental surface infection control is also very important. The coronaviruses, of which SARS-CoV-2 is a member, are envelope viruses, which are one of the easiest types to kill. So continue to clean and disinfect with an EPA-registered hospital-grade disinfectant approved by the EPA for use against SARS-CoV-2. SARS-CoV-2 is the virus strain that, when transmitted to humans, causes the disease called COVID-19. The EPA publishes a list, they call it List N, of disinfectants that are effective against these viruses, and it may be found at this website. Follow all instructions for use of the disinfectant from the manufacturer, including the time of contact required for proper disinfection. Categories of environmental surfaces include clinical contact surfaces and housekeeping surfaces. Clinical contact surfaces have a high potential for direct contamination from spray, spatter, instrument contact, or contact with a gloved hand. You must use an EPA-registered hospital disinfectant with a tuberculocidal claim that is on the approved list for effectiveness against SARS-CoV-2. In addition, barrier wrap things where possible. Should a COVID-19 symptomatic patient ever be present in your operatory, the CDC states that you should clean, disinfect, or discard the surface, supplies, or equipment located within 6 feet of the patient. Housekeeping surfaces would include floors, walls, and unused counters. There's a limited risk of disease transmission, and here you can use an EPA-registered low-level disinfectant. CDC guidelines for sterilization and instrument processing must be followed. The instrument processing area must be separated into 4 distinct areas. The first, receiving, cleaning, and decontamination. The second, preparation and packaging. The third, sterilization. And the fourth, storage. Instruments must be thoroughly cleaned before sterilization, and you must use internal and external indicators on all sterilization packaging. Remember not to interrupt the sterilization cycle. This includes the drying cycle. And weekly spore testing of all autoclaves and dry heat sterilizers is required. To prevent sterilization disasters, where clean and sterile instruments get mixed up, the 4 areas must be clearly delineated. Let your dental team know that things will return to a new normal that will be close to the old normal, but that it's going to take some time. Let them know you're monitoring the situation and are following all OSHA, CDC, World Health, and ADA safety guidelines. Use your downtime to conduct annual required OSHA safety and infection control training for your staff. Make sure your team has the information they need to effectively communicate with your patients. Send a letter to your patients. Let them know you'll be available to treat their emergencies, and that you're in the process of transitioning back to regular care. A sample letter is available at compliancetrainingpartners.com. Most importantly, let your patients know that their safety is of prime importance in your office. To sum it all up, we can get through this, but we need to stay current with updates from CDC, ADA, and World Health. Understand that there'll be a phased-in approach, provide ongoing education, including annual OSHA training and infection control training to all staff members. Utilize PPE, engineering controls, work practice controls. Practice standard precautions. Carefully screen all of our patients. Use the appropriate disinfection techniques. And consider for this COVID-19 pandemic period going beyond standard precautions. And most importantly, reassure patients you're available to treat their emergencies, their urgencies, and that your facility follows all current OSHA regulations as well as World Health, ADA, and CDC guidelines. Visit the Compliance Training Partners homepage for the most current information on COVID-19, N95 respirators, fit testing information, and strategies for getting back to work. Visit them at compliancetrainingpartners.com or email them at info@compliancetrainingpartners.com. Feel free to contact the Technical Services team at 888-388-4782.